Hello dear students and doctors. Now today we will continue our lecture on posology part 2. In part 1 we have discussed about general rules about potency selection. Now in part 2 we will learn about when to use particular potency and repetition. When to use 200 potency. This is the most common potency to start with at the first interview. If the homeopathy picture is not so clear, you should certainly not give higher potency. Especially new homeopaths should not give higher potencies. With heavy remedies, you better not prescribe higher than 200 like alumina, phosphoric acid, plumbum mat, stannum, zincum, etc. If you start with the 200, you will have all the higher potencies are reserved for the future. If you have give several remedies without results, stick to the 200 potency for the next remedy and do not go higher. If you had a good reaction with the twice and the third time there is no reaction, you can give 10 m or 1 degree higher. If this does not have effect, you ought to try 200 before leaving this remedy. Never change a remedy too quickly when it has worked. In acute disease, you have to start with 200 potency. In acute disease in children with a very clear picture, you may give 1 m if necessary. Only in acute case of arnica or aconite should give a higher potency. Now when we should use 1 m potency? In case of first prescription in a strong individuals with a very clear picture. In case of first prescription in children when the picture is very clear. In emotional or psychological problems, for example, stimulation where the Staphylococcus aureus or Echinacea are indicated, you can give higher potency. And I had an experience when the emotional trauma and the causative factors are emotional is there. Echinacea, Staphylococcus aureus in a higher potency work wonders. If the patient has been on allopathy medication for a long time, in an acute situation where arnica or aconite are indicated, when the lower potency has no effect anymore. Now when we should use 10 m, especially on emotional problems when there is a clear picture and the lower potency already used up. In serious acute disease, after the lower potency are used up like pneumonia, pyelonephritis, etc., you can use. In children with psychological problems who need a strong remedy such as the belladonna, veratrum, stramonium or hyoscyamus. Now we learn about repetition in high potency. Do not have to repeat a remedy to make the remedy act better, nor do you need to give a higher potency to achieve a better result. Instead, giving a single remedy in a certain potency, and the best thing to wait and watch and then carefully analyze the reaction. In the absence of reaction, retake the case. Please retake the case and look for a more suitable remedy. Now in certain situations are ideal for repetitions, like in a complete relapse when the patient has many complaints as before treatment. In a case of an antidote which cause a complete relapse, and you can repeat the same remedy in the same potency. In emergency conditions, complaints can repeat frequently and evaluate the patient on a day-to-day basis. Nosores like tuberculinum, medoridum, sodinum, syphilinum and lachesis may not be repeated too quickly in a higher potency. When an incorrect remedy in higher potency is given, you can easily cause suppression. The higher the potency, the longer the suppression will last. Giving incorrect remedy frequently in higher potency will produce confusion or spoil cases. So for all this reason, do not give higher potency if picture is not very clear. Please note, my dear students, never give a remedy during an aggravation, proving or suppression time. As far as possible, wait till there is a requirement to repeat. Now another way of giving repetition is combinations of potencies. When you are sure the remedy has worked well and still indicated, and you are confused concerning the potency, many times this happens, you can combine potencies. For example, let us discuss. You had a good action with 1M potency. In a relapse, 1M did not work, but 10M helped well. So in a new relapse, 10M or 50M did not help. You can try then the 3 potency on the same day. For example, 200 in the morning, 1M in the noon and 10M in the evening. Maybe one of the potency will work. But my dear students, this can only be done in an emergency when the same remedy remains clearly indicated. Again I am repeating, clearly indicated remedy, and when the appropriate no longer act. Now let us talk about placebo. This is the best remedy. It is very essential for beginner to use placebo in their practice, as it helps as a better relationship with the patient who is not used to homeopathy yet. Since most of the patients are in a habit of taking allopathy medication in a frequent repetition for years, giving a placebo 2 or 3 times in a day is a good substitute. Again, the anxious patients who depend on frequent repetition or need different medicines for different ailments at the same time can be kept satisfied with the placebo. Placebo plays an important role when the medicinal aggravation has occurred. It is prescribed when the system is in a process of settling down. Whenever the remedy is not properly clear, which the patient requires, give placebo until the picture becomes clear. However, the practice of giving biochemic medicines as a placebo is not advisable. Finally, I summarize factors which influence the selection of potencies are: first, certainly about the remedy chosen. Second, kingdoms of the medicine, means source. Third, age and gender of the patient. Then sensitivity of the patient, vitality of the patient, type of disorder, whether it is a functional or pathological, severity of pathology, acute or chronic nature of the disease, type of response desire, palliation or cure, and last, miasm of the patient. A homeopath should be open to using the full range of potency available to him. The certainly in potency selection grows with experience. If you are confident of your remedy selection and the desired action not there, try changing the potency to higher or lower before you decide to change the medicine itself. You cannot be flexible in your remedy selection. For cure, a remedy has to be similar, but you can be flexible about the potency selection. A given case may respond to more than one potency for the same medicine. While choosing the potency, just remember Hahnemann's words that an ideal cure has to be quick, gentle, and permanent. Things will become easier. So, my dear students, thanks for hearing entire posology lecture. And if you have any doubts, you can certainly comment on email, and stay healthy and happy. Thanks.